right, so hi everyone. Welcome to the Aspects YouTube channel. Today we're talking all things PCOS. In light of PCOS Awareness Month, we want to shed light about this condition that affects 1 in 10 women in the United States. I'm here with Dr. Basma Faris, a certified OB-GYN. She is certified culinary medicine specialist, founder of PolyPrep, a program designed for women with PCOS, and former registered dietitian. So thank you so much for being with us here today. I have no doubt that we're going to learn so much from you. How did you start even in the healthcare industry? Like, what made you want to be in PCOS for women?
So I studied nutrition in college, and there's a few different careers that you can pursue when you study nutrition. I chose the route of becoming a registered dietitian. I went to medical school after working for several years as a registered dietitian. I really gravitated towards caring for women, and as I became, after medical school and in my training, I really, again, found a lot of utility in my knowledge and background when caring for people with polycystic ovarian syndrome. Fast forward the pandemic, which really, sort of prompted a lot of changes in what I do, in that telemedicine really became part of our world, right? And for what I do as an OB-GYN, as you can imagine, telemedicine can be challenging, right, for certain complaints. But where I really found actually maybe it was even better was that I could see my patients with PCOS in their homes. I could see them more regularly. So I actually decided then to create PolyPrep MD, which is the telemedicine part of my company, which is a telemedicine practice dedicated for people with polycystic ovarian syndrome, where I combine sort of my two skill sets, and I treat PCOS with a combination of nutrition and medicine.
I'm really excited for this video because I think there's so much misinformation out there about PCOS. Like, I can't imagine somebody that is trying to research all of this by themselves. I wanted to start with the basics. If you can let us know, describe in simple terms, what even is PCOS?
I mean, I would say the number, like what's even problematic is the name, right? So PCOS stands for Polycystic Ovarian Syndrome, and it gets its name from the observation of the ovaries on ultrasound and how they have lots of little follicles in the ovary, which really they're not true cysts in the way that we think of, I have this large painful cyst that needs surgery. They're actually, follicles are the normal little cysts that house our eggs. And in people with polycystic ovarian syndrome, they have many of them. And so it gives that appearance on ultrasound. Aside from we can use ultrasound to help diagnose it, it really has very little to do with ovarian cysts. Really, it's a hormonal disorder that impacts people's metabolism, and it causes people with PCOS, their bodies to produce more androgen hormones, which are testosterone and DHEAS. It interferes with ovulation, so people can have irregular periods and infertility. And many people, in fact, probably the majority of people with polycystic ovarian syndrome, have some metabolic differences resulting in insulin resistance, which I know we're going to talk a lot about today. It was simple enough. It's a complex disorder, and it's hard to sort of make it any simpler than that.
Right, of course. I think I like what you said at the start. Like, even the name itself is kind of almost already difficult to understand, as much so it's the hormonal disorder that you mentioned before. As soon as you hear polycystic ovarian syndrome, your mind just instantly goes to the cysts and the ovaries, but it's definitely much more complex than that. What do you think is like the biggest factor that makes it hard for women to be diagnosed?
Yeah, I think there's a few different factors. A, sort of lack of comfort in people talking about their periods. We're still, even though we're so much more open about discussing reproductive health and menstruation, I think there's still some of that discomfort that people have.
Right.
I think people, oftentimes it's a cluster of symptoms that people often get dismissed, or they will be blamed, because I think there's still some of this idea that people with PCOS it's all caused by things that they're doing. Yeah. And so I think that sort of keeps people out of the healthcare system and interferes with their ability to be diagnosed. And it can be kind of nebulous, right? It can be kind of vague. People can have a lot of different symptoms that maybe are not so obvious. And so I think those are things that can be dismissed as well. And then I think there's just still a gap in education. There were many different diagnostic criteria for PCOS. And I think, what is helpful is in the last year, the most recent international guidelines for the assessment and management of PCOS really has honed in on one criteria to use, which I think is really helpful and I think is going to help people get diagnosed going forward. Because historically there were sort of many, like you could choose from 3 or 4 different criteria. Yeah. And I think that can do things.
I would love to talk about PCOS and insulin resistance, as I feel like, or even just scouring kind of through the content pages of PCOS, social media, not a lot of people, surprisingly, are talking about this correlation.
Let's talk a little bit about what insulin resistance is. I think we need to understand what insulin is first, and then we can understand sort of where things go wrong. Basically, insulin is a hormone that is, in normal conditions, is released by our pancreas. So after we eat, the carbohydrate in the foods that we eat, it goes from the intestines into the bloodstream, and that goes to the pancreas. And the pancreas basically sees or senses how much carbohydrate in the form of glucose is in the blood and releases insulin as a result. The job of insulin is to take that glucose and signal to the cells to open up and allow that glucose into the cell. Insulin resistance occurs when there's that message is not being relayed properly. The insulin gets to the cells and it's supposed to tell the cells to open up and let the glucose into the cell, and there's a disruption somewhere in that process.
Okay.
And so what happens is the glucose isn't able to enter the cell, and so the cells don't have that glucose needed for energy to function properly. So that's one thing that happens. The cells don't function properly because they don't have the energy to carry on. And then the glucose still stays high in the blood. So as a result, the pancreas puts out some more insulin, right, to resolve it, because it thinks all it does is it sees that there's still glucose floating around. So more insulin is produced. Somewhere between 60 and 90% of people with polycystic ovarian syndrome have insulin resistance. And so even though it's not part of the diagnosis of PCOS, everybody with PCOS should be evaluated for the presence of insulin resistance. And so many of the symptoms come either from the inability for the glucose to enter the cell so that the cell works properly, or the excess insulin that's now floating around.
So what consequences does that have in relation to PCOS, this excess insulin or this inability for the cells to obtain glucose?
So a couple different things happen. You don't feel like you have the energy, right? So there's fatigue, either in your body, your brain. You don't have the strength to be very active. And so in that regards, many of the fatigue symptoms come from that. The excess glucose ends up being converted into fat because it's not being utilized as glucose. So the liver converts it to fat, and that fat can be deposited in different places around the body, sort of around the middle, in the liver. And so places where it's not really supposed to be. The glucose itself can bind to different structures in the body, and that can contribute to vascular disease and heart disease, etc. The excess insulin, so insulin has more than the function of just allowing glucose into the cell. It does other things as well, and it stimulates growth of other hormones. So in the ovary, there's a type of cell called theca cells. And these theca cells primarily produce androgens, testosterone. If there's too much insulin, the insulin stimulates those cells in the ovary to keep producing more testosterone. And that can result in some of the symptoms, the skin symptoms that people see, like acne and facial hair and balding. And that's from the excess androgens. The same thing can also happen in the adrenal glands. The adrenal glands are little glands that sit on top of our kidneys, and they produce androgens, and they also produce some other hormones like cortisol, and the excess insulin causes them to be stimulated as well. You really see things happening kind of on both sides of the equation. The cells themselves are not getting enough energy, and the insulin, the excess insulin that is produced as a result, is also causing havoc in other systems. So that's why PCOS isn't just a problem of having irregular periods. It's really like a full body condition that can have many, many different symptoms.
I think there's a lot of terms thrown around in the PCOS space that you can reverse it. But then science tells us that there's no cure for it. Do you think like PCOS is reversible in a sense, or is that a term that's too loosely thrown around?
Reverse means you're going to get rid of it completely. And I don't think that that is the case. You can really learn to minimize your symptoms so that your symptoms are minimal.
Yeah.
And certainly there are many different strategies for doing that, but your sort of underlying predisposition or risk for that coming back is still there. Some of these things are genetic, medications, lifestyle, all these different things can change your genes. We call these epigenetic changes. And those are hard to reverse. And certainly genetic changes, really, you can't reverse.
I think there's also a lot of misinformation revolving that PCOS is caused by that person's choice through their lifestyle choices. What is the truth on that?
So I would say no, right? Because somebody else can make the same choices and not end up with the same symptoms. Yes, people's choices can impact how their body functions, but it is unfair to make that claim for people. We know that people with PCOS have a higher chance of weight gain. They have a higher chance of developing obesity. There are studies that look at, if you compare two groups of people, those with PCOS and those without, given sort of the same choices, people with PCOS gain more weight more rapidly than people without. So it's not to say that somebody else making the same choices won't gain weight, but they won't gain it as quickly and they won't gain as much. We want to encourage people to make choices that work better for their body, but to say that people are responsible for their disease is really unfortunate.
So you mentioned before briefly that we can't reverse it. However, we can minimize our symptoms drastically. How are we able to do that through lifestyle changes and through managing our insulin resistance?
So I'd say, especially given that the majority of people with PCOS have insulin resistance, managing that side of it is probably, the highest yield for most people. And when I think about managing insulin resistance, I sort of think about it from two sides. How can we both reduce the amount of stress we put on the pancreas? So that means finding for each individual person how much carbohydrates is appropriate for them in each meal, what food combinations they can utilize so that they get just the amount of carbohydrates that they need, but not too much. And then on the flip side, how can we actually improve insulin sensitivity? And there are things that we can do on the insulin sensitivity side, and that's more through movement and anti-inflammatory foods and good sleep and stress management. So we really are looking at it from both sides of that equation.
If somebody was to take the first step to managing their PCOS after watching this video, listening to what you have to say from the scientific point of view and from an expert, what do you think is the first step that they should do that would already significantly improve their PCOS symptoms and start on the path to better health?
Honestly, I would say don't go it alone. There are people out here that are knowledgeable and can help, right? There are apps, there are devices. We're going to talk a little bit about the use of continuous glucose monitors, which I think is a really great technology and great strategy that I think has been underutilized in the world of PCOS that we could use to help people fine tune what is right for them. So I think obviously it's not accessible to everybody, but they are becoming more readily available. The cost is coming down on them, and we're having a much better understanding of how to use them for people with PCOS. I think up until now, CGMs have been used either by people with diabetes, right? Or healthy people who probably don't really need them. And I think PCOS really, because we know insulin resistance is such a big part of it, and we want to kind of catch that before it develops into something worse. Right. What a great opportunity to do so, and what a great tool that we could use to help people really fine tune for themselves, sort of craft their nutrition and craft their meals so that they get the amount of energy that they need without overdoing it.
Definitely. I think with the CGMs, I actually just finished wearing mine today. It was the first time ever I was wearing it. It was very
how was your experience?
It was very weird. I mean, it was for the first time ever I used something like this, but it was really incredible to see, like, oh wow, I ate this all the time, but it's actually really bad for me. Like, that, no wonder I have headaches, or my heart accelerates, or I feel stressed. I feel like throughout my whole life, medicine was always kind of treated like one size fits all type of approach, especially if I would go to the doctor about my cycles, if they were irregular and such. It was pretty much very one size fits all approach. So kind of learning about this new approach of personalizing it exactly to your body's data was very new for me, but it was a really fun experience.
You learn so much.
Exactly.
Every now and again, I'll put one on, and it's really eye-opening.
Yes.
And it can help you to figure out what's right for you, and what works for one person is not going to be the same for somebody else. And I'm so glad that we have that, that ability to, I think, pretty easily start to personalize our approach for people.
I want to talk a little bit about food. I think throughout finding ways to minimize PCOS symptoms, diet, of course, plays a huge role in the food you eat, especially eating balanced. What to you means eating balanced? Giving like examples of how a person can start doing that.
So I sort of like just use a very sort of simple approach, which I think when people are choosing meals, they want to make sure that they include a plant, right? Because plants contain fiber, and people don't get enough fiber. And what fiber does is fiber helps to slow down the digestion of what's in our stomachs, right? And in our intestines. And so the glucose, the carbohydrates in our food have the chance to enter our bloodstream slowly. A protein, and it can be a plant protein or it can be an animal protein, depending on your preference, and then a small amount of healthy fat. So a plant, a protein, and a healthy fat, if you just sort of follow that like as a start, you will see, because each of them has a little bit of a different role. Protein is important for maintaining our lean body mass. It also it's very satisfying. When you eat foods that have protein in it, it helps to stimulate hormones that are produced in our digestive system that make us feel like we ate. Plant foods can be things like whole grains, vegetables, fruits. I know people sort of have questions about fruits when they're in PCOS, but fruits are a great source of fiber. Any plant food that has fiber is going to give you a little bit of carbohydrates that you need for energy, but they're going to be slowly digestible carbohydrates, and that's really what we're looking for. We don't want carbohydrates that digest quickly. And then a little bit of healthy fat, like things that like nuts or olive oil or avocados, is really important for the function of all the different membranes, our cell membranes, our mitochondria. So I try to sort of use that in my own life. I like to try to give advice that's simple, and I think that's one way of doing so.
One of the things that actually I struggled with the CGM was identifying, was that spike healthy or was it not healthy?
Anything after a meal under like 140 or less is considered normal and healthy. And when we get into things above 140, either that represents your body's inability to handle that amount. And then the other thing is you want it to come back down. By 2 hours, it should come back down to what it was before your meal.
Got that.
So those are sort of the two things that you kind of want to look out for.
So now that we talked a little bit about food, I remember you mentioned even briefly at the start of the video a little bit about exercise and movement. What are the benefits that exercise and movement have on insulin sensitivity, and why is it important?
Moving your muscles does something very similar to insulin, even when insulin is not around. When you move your skeletal muscles in the form of exercise, right, or just like walking, whatever kind of movement, it actually tells the cell to open up and let the glucose inside. Kind of like a little bit of a workaround to help lower your blood glucose. That's why it's recommended for people who have issues with insulin resistance to walk after meals, because that's sort of one way of getting the glucose into the cells where they need to be, even if your body is not making enough insulin.
Yeah.
That's like the number one sort of short-term effect. The next effect is that with repeated exercise, the cells in your body produce more, they're called GLUT4 receptors. These are basically the gates in your cells that allow the glucose to go from the blood into the cell. And the more of those you have, and the more of those that open at once, you can imagine sort of the easier it is for the glucose to get inside the cell. And then thirdly, if you're doing strength training especially, and you build more muscle, if you can imagine, the more muscle you have, the more of those activities are occurring. So you can then use more of the glucose that's in your body. Exercise also helps with stress reduction, which is really important. It's really helpful for people with any sort of mood disorders, anxiety, and depression. Yeah. And so I think there's so many different ways that exercise of different types, and it doesn't have to be one type in particular that can help people with PCOS.
I had actually a question from one of our users that came, and this is something I'm very interested in as well. Of course, there's so many different ways to exercise. So what exercises do you think is the best to for women with PCOS?
So that's a tricky one. I think, if you really look at what the whole body of the literature are, the recommendations are kind of the same as for the general public. You want to make sure that you're trying to get 150 minutes per week, and that you do a combination of, quote unquote, cardio and strength training, because there are benefits to both, right? Yeah. The benefits of doing cardiovascular exercise, cardio, is for heart health and making sure that your heart is healthy, and to burn some of the energy. And then strength training is important for maintaining muscle mass or building muscle mass and for joint health. So they both have their benefits. If you hate something and it's going to make you miserable, don't do it, right? Find an alternative. If you hate running, could you do an incline walk instead with some music? Can you just put some music on and dance to get your heart rate? Don't overthink it. I know there are people out there, influencers, that are talk about this one's going to worsen your PCOS. I think most of that is probably nonsense. And the problem with so many people, or quote unquote experts, they take their experience and apply it to everybody. And just because something worked for somebody and they had a lot of success at it, doesn't mean that that is what is right for the next person. And so this is what we're trying to help people identify. What is working well for you? If you're doing something and it's not working well for you, well, then we have to adjust. It's not one size fits all. So to think just because one person's success means that that's the answer for everybody, that's ridiculous to me. It means that worked for that person, and it doesn't mean that it's applicable to everybody. I think we have to be careful when, people say sort of these really strong blanket statements that apply to everybody.
Definitely, it's easy to fall trapped to it. Especially, and then it takes an expert such as yourself to say, well, actually, it's a lot more complex and it's not always so black and white. It looks like we're coming to an end. I would just like to talk a little bit about Aspect. One quote that I really like that they feature is, "Your body has a story to tell. We'd like to help you listen." And I think that just perfectly describes the approach that you've even mentioned yourself, that everybody is so different, and this one-size-fits-all approach, cookie cutter frames isn't the way to go, and to actually find out what works best for your body to manage PCOS symptoms effectively. So Aspect Health, not only do they send you a CGM, continuous glucose monitor, that can give you real-time insights into how your body responds to food, to events such as your sleep, your exercise, as well as your stress. They also pair you with a personal health coach that will guide you every single step of the way to help you create personalized health plans to get you to your goal. So if this sounds like the solution you've been looking for, please take our PCOS quiz to see if you would be a good candidate for the PCOS program. You will find it in the link in the description. And it's a complete different approach, I think, to PCOS. Now, I don't think it's that popular to hear a solution that is unique to this person's body. Oftentimes it's like, this is the health plan that should work for everyone, rather than this is a health plan unique for you, and unique for you. I would love to hear a couple of your thoughts about Aspect's approach, and what do you think of this new revolution of health?
I think it's really exciting. I think, we really have so much incredible technology that hasn't been optimized. And so I'm really excited to, really help to develop how we can use the CGM data, how we can personalize people's nutrition and sort of like whole life plan. Right. How do we use other wearables? Like there's so much data that now we can learn about our bodies from, wearables that are really easily accessible. The problem is they're coming, right? They're like coming from all these different sources, and there's all these different apps, and like, how do you put it all together so that it makes sense? And, that's one of the things that we're trying to do. So I'm like beyond excited about it.
Definitely. Me too. And I think this has the power to change and help so many women out there. So it's incredible. And I guess just to kind of finish it all off, what would you say, kind of words of wisdom, words of advice for any woman right now that would be watching this video struggling with their PCOS? What would you tell them right now?
So don't go it alone, okay? Yeah. Find reliable sources of information. I know it can be hard. That's why we, came on here today to make good, reliable content, and there's more of it on the website, and there's more coming. So find good, reliable sources. Find a community of people who gets it, because it can be lonely. It can be lonely when, your friends around you aren't experiencing it and don't know what's going on. Understand that this is a process. You're not going to get better overnight, but little by little, changing your habits, you can improve your health dramatically. You have the power to do so. You just need a little help. You need some tools to help you to do it. You need support, and you need good, reliable information.
Absolutely. And I think that's definitely out there. I think a lot of women can feel alone in this, but this is then your reminder that there's support, there's experts out there just such as Dr. Basma, and communities like Aspect Health that are here to support you every single step of the way. So final call, the link is in the bio. Link is in the description. This will be for YouTube, so that you can take your PCOS quiz and just take the first step towards better health. So Dr. Basma, thank you so much for taking the time to be with us here.
My pleasure.
Definitely this is going to be so valuable for so many women out there seeking solid, good, reliable advice. So I really appreciate it. Aspect Health definitely as well. And that is it for today. Definitely subscribe and like if you found this helpful. Share with others to spread good, reliable information. And we'll see you in the next video.